Definitely in the second wave, we are seeing much more children than we did last time. In fact, the ICMR statistics a few days back suggested an 8-fold raise from 0.5 to 4%, but that was also a few days back. Seems to have been much more than that. Now, there are a couple of reasons for which this is happening. One, the mutants that are due in India. It's no more the double mutant, it's now the triple mutants. We've got 3 mutants that are new, besides a couple of the UK variants in the Brazil, etc. Now, besides that, of course, we let down our guard, and some of the children started going to school, to the tuitions and playing around and all. So these children were exposed more with the other children. And of course, thirdly, the parents are getting more infected. So obviously the children are more at risk than that. But having said that, earlier they were more asymptomatic and now they are more symptoms. So overall, you see that the burden of children with symptomatic corona has increased. But fortunately, most of the children have mild symptoms. Majority of the children, they actually have very mild symptoms, and like the typical corona in the first wave, you get the respiratory signs, which is like fever, cold, cough, and but besides that, this time what is very unique is we are seeing much more load of children presenting with GI symptoms like pain abdomen, vomitings, diarrhea. Now, in addition, of course, lethargy and a little malaise, body aches are quite common. What is very interesting is that in children, we had come across this condition called MISC, which is multisystem inflammatory syndrome, where more than one system is being involved. That is, your immunity fights against it. Just like in adults, you get the cytokine storm, which is, in the second week. In children, we were seeing that a few weeks later. Both the UK and the US were the first to report on this. But this time, in the second wave, this multisystem involvement, where there are more than 2 organs involved, besides, like high-grade fever, one may have symptoms which are related to liver involvement or GI involvement or skin involvement or eye involvement, joint involvement, heart involvement. So anything more than 2 systems are being involved. And this we are not seeing few weeks or month later. We're actually seeing a bit earlier. So we might end up with a patient or a child who has COVID RT-PCR positive and still develops this syndrome. And that is being different from the first wave, which I thought I should alert. That it's a unique manifestation in children and you've got to be careful about it. So most of the time, fortunately, the symptoms that are seen in children are mild. Unlike in adults, where we say 15% can get severe and 5% critical, in children, overall, the burden of criticalness is to the tune of 0.5% or less. So what is it that we can do? Number one, parents should not panic. Majority of the time, children are mild. Do not give your anxiety to children and treat them symptomatically. Keep them at home, give them rest, give them good hydration. Try to keep children away, especially from grandparents. Do not send the parents off to children to grandparents to take care, because they are more susceptible to severe infections. So avoid them. One of the family member can take responsibility as a caretaker for the child and should use the mask and take care of the child. Besides the hydration, rest, use paracetamol SOS when there is fever or pain. Don't use more than 5 doses of paracetamol in the form of 10 to 15 milligram per kg with a cutoff of max 500 to 650 depending on the weight of the child. And besides this, if you have vomiting, we will give you antiemetics. If you have diarrhea, don't forget to use ORS to prevent dehydration. And for cold and cough, symptomatic treatment. One important message is to avoid steam in small children because there are more accidents. It doesn't do as much good as it can harm because of the risk of burns and accidents with steam. And also those children who have earlier were used to having cough and nebulization. I would suggest using a puff MDI with a spacer is better than using the nebulization because it creates more aerosols, and that that COVID spreads through aerosol. And that is one suggestion. But at the same time, we need to give parents certain warning signs when they should immediately report to the hospital. Of course, having said that, all parents are going to be in touch with a telephonic or a WhatsApp video consult with their doctors. And what are the warning signs? Anytime when the respiratory rate increases, they get fast, which is usually 50 in an infant 1 year or less than 1 year, or 40 in 1 to 5 years, and more than 30 in older children, like in adults. And besides that, if the child is getting drowsy, lethargic, listless, looks dehydrated, not accepting orally, and of course the pulse ox saturation, we monitor the saturation. If it gets less than 95%, the child would need oxygen, and that's when, or when the fever is going high grade beyond 5 days, then again you need to get in touch with the doctor so that we are able to treat the child in that. All places now are making arrangements to have COVID children in their hospitals, and dedicated hospitals or dedicated centers within hospitals are created to take care of children. Though a minuscule of them have been reported to be very serious, like requiring ventilators, etc., majority of them have these mild symptoms, and some the pneumonias, which we are able to treat effectively. Having said that, I just wanted to give an alert to few parents. There are few children who are at very high risk. Obesity is a major disease. Your child who's obese has high risk of getting severity, or when there is renal problems, chronic renal disease, chronic liver disease, oncology patients, patients with cancer or on steroids, patients who have been post-transplant immediately and on high dose of medications. These are the patients who need to be on red alert, and I would suggest be in contact with your doctor so that you are able to avail the services quickly. And please, prevention is the best way. Don't forget that we need to use mask, and children over 2 years can use mask. An important message: use the right way of mask, covering your nose and mouth. There's no point having a mask which is hanging down. Besides that, we've been talking about good ventilation at home because we think now it is probably in the air and it's not only the few feet, but it can be much more, 20, 40 feet. So good ventilation and breathing exercises for children, Anulom yoga or ballooning, blowing balloons, which improves your lung capacity, and a good nutritious diet, which involves fruits, vegetables, proteins, dal, egg, seeds, nuts, is very important. And sleep with no stress and anxiety, which improves your immunity.